So the question I will be addressing in this presentation is whether adolescents should be allowed to make their own life death decisions. And I would side with the yes side. And my arguments will kind of support uh, this idea. So to give a little background about this topic, I will first define an important term here, which is consent. And consent, according to the English Oxford Dictionary, is the permission for something to happen or agreement to do something. And for the sake of this topic I will be discussing, I would refer more to informed consent, and that is the process by which a patient learns about and understands the purpose and benefits of a potential medical intervention. So, a little more of a background, it's the differences in legal rights that minors had in the past versus the present. And traditionally, federal and state laws did not give much legal freedom of choice to adolescents because they were considered incompetent and thus legally incapable of making medical decisions due to their age. They believed that they lacked the experience of judgment and the cognitive ability to reason. So the power to make important health decisions relied were um, their parents or legal guardians. Okay, so um, it was not until a few decades ago that new laws were introduced, giving a different view of legal minors and their rights. And the first bullet point here, pointing out that it was not up to the to 1971, where the age of majority was 21, but it was actually lowered to 18 years old, and that granted legal adulthood to millions of people. And one of the legal rights they had was to grant consent for medical treatment apart from their parents. Um, Another change was the creation of legal categories, and such of them were emancipated minors and mature minors. And basically, there's not much difference, but emancipated minors, it's on the basis of marriage or parenthood, and then mature minors, it's based on jurisdiction. So they were determined that they were mentally capable of understanding the the treatment that they were receiving, so they were considered mature enough, or they were still minors. And um, now the last point here is a law that allows adolescents to consent to certain types of medical care without having the parents involved, but these are limited. For instance, um, they could not go and seek medical treatment if, for instance, they have a sexual transmitted disease, or they were pregnant, or they wanted to prevent a pregnancy. So there were some of the limitations they had. So there are 47 states in which adolescents have living will status, and 48 in which they have surrogate decisions making, including life or death decisions, which again, this is based on the medical.
So there is still a current issue going on here, and that is the fact that there are very few state laws that give complete authority to adolescents when it comes to making their own life and death health decisions. And I believe this is totally wrong. And one of the arguments state legislators rely on is the fact that adolescents cannot give informed consent because they lack experience, understanding, and maturity.
So one of the things I wonder is when, what, and how would one determine the level of maturity of an adolescent, a minor? And I believe that the level of maturity of someone has cannot be measured. However, I believe that not everyone should be able to make their own decisions. For instance, infants and children under the age of 12 should not be considered capable of making their own life and death decisions. Children over the age of 12 have some type of cognitive ability to understand any type of situation, and therefore they should be able to participate and make their own decisions when it comes to their health. And as it was mentioned in the book, uh, most of the adolescents that want to participate in decision making are the ones that have a medical condition with chronic diseases. And I believe they should be granted that power of deciding what to do with their health, because besides dealing with a chronic disease, they are also experiencing other issues, such as depression or neglect. And sometimes the people around them, like family members, would not know how it feels. And I believe it is not fair for them.
I wanted to end this presentation by talking about Mill's theory. I believe that it best supports the yes side of allowing adolescents to make their own life decisions, because we must first consider the ordeal that these teenagers are going through with the chronic conditions. I underline two things here, which is considering consequences and maximizing happiness. Throughout the years, these teenagers have these chronic diseases, and very often they are getting worse and worse, which means that besides dealing with it, they are dealing with so much more. As it was mentioned in the book, and I previously also mentioned, they are going through psychological suffering as well as depression. Their families are also suffering with them because they're seeing their child go through pain and they cannot do anything about it. Yet they do not want their kids to make their own health decisions, which is ridiculous. They are thinking about their own interest because they do not want to lose their child. They want to keep fighting and be determined someday their child will be okay. But in a way, you gotta be realistic. At, at some time, at the same time, they are being selfish, and they're not thinking about the difficulties that this kid is going through. Therefore, I believe that if we consider the consequences and try to maximize happiness, we are ending the suffering of this kid by making him or her take the wheel. Like if they want to keep receiving treatment or not, or they just want to die. So we are actually also ending the suffering of the family, and we are maximizing happiness here.